Community analysis: Sun City Center and surrounding communities of Apollo Beach and Ruskins. Historical overview of the community. Sun City Center community was formed during the land boom in the 19th to 20th centuries. Predominantly, Sun City Center was a farming community with limited infrastructure and transportation. The year 1915, the railroad came to Sun City Center, and the building of the railroad populated new businesses and improved infrastructure such as sidewalk, indoor plumbing, underground wiring, power plant, general stores, gas station, and a post office. When the 1970s came around, it saw a rise in mobile home parks and a tripling of the population. The community of Sun City Center and surrounding areas of Apollo Beach and Ruskin has evolved in a developed community with a solid infrastructure, transportation, and amenities. The community now boasts one of the nation's largest electronic commerce and cloud computing company in Amazon. Analysis of the structure of the community. Structurally, the needs of the community is adequately met because the infrastructure is developed to meet the needs of the entire community, medically, socially, and economically. There is a general medical and surgical hospital, a fire station, a private emergency squad, a post office, public and private transportation, railroads, schools ranging from kindergarten to community college in Hillsborough Community College. There is an array of supermarket, department stores, hardware stores, one of the major one being Home Depot, restaurants and pharmacies or drugstores, the leading drugstore being Walgreens and CVS. There's a number of clinics, churches, social services, government programs, and voluntary programs. There exist a number of recreation centers and parks. The issues related to the structure is the lack of universities and sidewalks. An analysis of the population of the community of Sun City. Population issues were minimal. The population is well distributed. The community has a balanced mix of ethnic groups in relation to the population. However, there is a greater number of elderly people living in the region, but this is expected because the Sun City community is a retirement community. During various interviews of random citizens within the community, the general consensus was that they were satisfied with the community in general. The major health concern in the community was, can the community effectively sustain a majority aging population? Hence, the emphasis is placed on medical facilities. An analysis of the adequacy of the health related resources and their availability. Health related resources are easily accessible, they're acceptable, and they are affordable. There is a general medical and surgical hospital, numerous clinics, both private and government owned, numerous pharmacies and medical stores. There is a privately owned emergency squad that works in conjunction with the state's EMS team to maximize services. Healthy People 2020 has specific community objective related to this retirement community. Number one, increase the population of older adults with reduced physical or cognitive function who engage in light, moderate, or vigorous leisure time physical activity. The rationale behind this is improvement in these areas will promote independence and diminish the feeling of uselessness, an aspect of depression often felt by older adults. Number two, increase the proportion of older adults with one or more chronic health condition who report confidence in managing their conditions. The rationale behind this is the ability to confidently manage health conditions will promote a healthier community and reduce rehospitalization, which will ultimately reduce the burden on the healthcare system. Number three is to increase the proportion of physicians with geriatric certification. Physicians with a greater knowledge of the population which they serve will give them an advantage when treating their patients. The geriatric population is unique and often misdiagnosed. This improved certification will result in a more focused treatment approach and better health outcomes for the patient. Analysis of the environment. The environment resources are adequate for this community. The water supply and the quality of the water supply meets the needs of the community and is tightly monitored and tested frequently to assure quality. There is adequate sewage disposal, reflecting a clean, healthy community. Solid and hazardous waste is disposed of in a timely manner, and air contaminants is at a minimum, which reflects in an air quality rating of 0 to 50. There is vector control programs in place to contain insects, rodents, and wild animals. One of the major issues related to the environment is controlling mosquitoes. This is a challenging task because of standing water from rain and ponds in the area. Another major issue is controlling wildlife. Because the community is surrounded by wooded areas, it is challenging to control wildlife. An analysis of the government and public policy. The government appointed community officials are very easily accessible through monthly community hall meetings and in their offices. Community meetings are well attended with a 95% attendance rate on a monthly basis. The budget accounts for a majority but not all aspects of the community. Residents would like to see more roads built for their golf carts and more laws put in place in regards to favoring golf carts operation, which is their main mode of transportation in the Sun City Center community. Prioritizing. Provide comprehensive disease and illness management, especially for chronic illnesses. This approach would improve the health of the community and decrease rehospitalization, saving millions of dollars which could be used in other areas of the community. Ensuring comprehensive health care and welfare are provided to the aging in accordance with their health care demands. This approach serves to promote a older, healthier population. This would reduce the burden on families and the healthcare system in general. Manage all common ailments that require basic medical care, treatment, and observation through the healthcare provider. This approach serves to prevent minor medical issues from escalating into major health issues, which would ultimately result in hospitalization and a decline in health. Another point is to ensure surveillance and control of all local disease, both communicable and non-communicable. This method serves as a preventative approach which would protect the community from a potential outbreak and keep the health of the community intact. Another priority would be to encourage community allies to improve community initiatives and programs that enhance and promote health, healthy behavior, healthy living condition, and healthy work environment. This approach is a primary prevention method geared at promoting a healthy community. Last but not least, increase the number of practitioners and healthcare workers who are educated on geriatric care. When healthcare workers are educated on the population they are serving, it will be an asset to promote health among the citizens of the community. These, this is a list of my references, and this is the end of my presentation. Thank you all.